Hello and welcome to Indian Institute of Public Administration. You're watching Governance at Work. Governance is about bringing in and implementing new schemes and programs that makes a real difference, whether by improving welfare, creating opportunities, or driving development where it is needed the most. Each week, we bring to you stories of schemes and innovations transforming communities and driving the vision of Viksit Bharat. In today's episode as well, we start with this week's key governance highlights. So let's start with the headlines first. The Prime Minister launches Swasth Nari, Sashakt Parivar Abhiyaan, prioritising health of women and children. IIPA conducts training program on public administration and governance for Odisha Administrative Service officers who also called upon the Hon'ble President of India. IIPA conducts evaluation of the impact of Mission Shakti in women empowerment in KBK district in Odisha. IIPA presents an article on strategies for increasing the contribution of women in nation building. Shiksha, Setu, Axom, an AI-driven initiative in Assam, received the Prime Minister's Excellence Award during the 17th Civil Services Day. With a view to provide preventive, promotive and curative health services to women, adolescent girls and children, the Prime Minister has launched Swasth Nari, Sashakt Parivar Abhiyaan last week. It is a nationwide initiative jointly led by the Ministry of Health and Family Welfare and the Ministry of Women and Child Development as a response to deal with real measurable health challenges affecting millions of women and children in India. With this, the government will organize over 1 lakh health camps across Ayushman Arogya Mandirs, community health centers and other facilities. This will offer screenings for non-communicable diseases, cancers, anemia, tuberculosis, sickle cell disease and maternal health. Also to promote nutrition education, menstruation hygiene, mental health awareness and healthy lifestyle counseling. At present, the challenges that persist include gender bias in healthcare access. Women often delay seeking care due to family responsibilities or social norms, shortage of female health workers in remote areas and limited awareness about preventive care and nutrition. The initiative aims to address persistent gaps in women's and child's health, especially early detection and treatment of critical health issues, reducing maternal and child mortality rates, improving access to quality healthcare in remote areas, strengthening community participation through Anganwadi workers, Asha workers and youth volunteers, aligning with broader mission like Poshan Maha, Mission Shakti and Eat Right India. So why was Swasth Nari Sashakt Parivar Abhiyaan launched? Let's look at the key statistics on women health in India. National surveys revealed high rates of anemia, especially among adolescent girls and pregnant women. Over 50% of women aged 15 to 49 are anemic. Anemia is a leading cause of fatigue, poor maternal health, and developmental issues in children. Screening rates are still low, with many women unaware of symptoms or lacking access to diagnostic services. Many women lack access to regular screening for diseases like breast and cervical cancer, diabetes, and hypertension. Only 57% of adolescent girls use hygienic methods during menstruation, with rural areas facing several access issues. India's maternal mortality ratio stands at 97 deaths per 1 lakh live births. Despite improvements, India still faces significant maternal and infant mortality rates, particularly in rural and remote regions. Early detection and timely treatment of complications during pregnancy and infancy were often missing. Janani Suraksha Yojana has increased institutional deliveries, but access to quality prenatal and postnatal care remains uneven. Mother and child tracking systems are helping monitor health outcomes, but coverage gaps persisted. Women, especially in rural areas, often prioritize family needs over their own, leading to undiagnosed and untreated conditions. The initiative aims to break this cycle by making healthcare accessible and proactive. Malnutrition and stunting among children remain major concerns. The campaign integrates with Poshan Maha to promote nutrition education and interventions like IFA supplements, deworming, and recipe demos. Mental health issues and lifestyle diseases are rising, yet awareness and support systems are limited. This initiative includes counseling and awareness drives to address these gaps. The Swasth Nari, Sashakt Parivar Abhiyaan is designed to be a massively inclusive and accessible, with a clear implementation roadmap and multiple entry points for beneficiaries. Here's how the government is rolling it out and how people can benefit.
अगर माँ ठीक रहती है तो पूरा घर ठीक रहता है, लेकिन साथियों, अगर मां बीमार हो जाए तो परिवार की सारी व्यवस्थाएं चरमरा जाती है। इसलिए स्वस्थ नारी सशक्त परिवार ये अभियान माताओं बहनों को समर्पित है, उन्हीं के उज्जवल भविष्य के लिए है। हमारा मकसद है एक भी महिला जानकारी या संसाधनों के अभाव में गंभीर बीमारी का शिकार न हो। ऐसी बहुत सारी बीमारियां होती हैं जो चुपचाप आती हैं और पता न चलने के कारण धीरे धीरे बहुत बड़ी बन जाती है।
Over 1 lakh health camps are being organized between September 17th and October 2, 2025. Camps are set up at Ayushman Arogya Mandir, community health centers, district hospitals and Anganwadi centers. Each camp offers screening for anemia, diabetes, hypertension, breast and cervical cancer, TB and sickle cell disease. Maternal and child services like antenatal care, growth monitoring, immunization, and MCP card distribution, nutrition support, including IFA supplements, deworming, Annaprashan ceremonies, and recipe demos, mental health and lifestyle counseling with specialists in psychiatry, dermatology, ENT, and more. Real-time tracking of outreach service delivered and beneficiary feedback ensures transparency and accountability. ASHA workers, Anganwadi workers, and Nikshay Mitra are mobilized to spread awareness and guide women to the camps. Private hospitals and NGOs are also participating under the Jan Bhagidari People's Participation Model. How beneficiaries can avail services. Women, adolescent girls and children can walk into any nearby health camps during the campaign period. No prior registration is required for basic screening and consultation. ASHA and Anganwadi workers are conducting door-to-door awareness and helping families reach the camps. Village-level announcement and posters are being used to inform communities. Beneficiaries are encouraged to carry Aadhaar cards and health records if available, but services are not denied in their absence. Those diagnosed with conditions are referred to higher-level facilities for treatment under schemes like Ayushman Bharat. So if you or anyone you know, especially those underprivileged women around you in need of a medical and health services, please explain these benefits to them. This campaign is not just about health, it's about restoring dignity and access to millions of women and children. It's not just a health drive, it's a social movement to build healthier, more resilient families. IIPA, in collaboration with Gopabandhu Academy of Administration, Bhubaneswar, organized an induction training program on public administration and governance cum exposure visit for officer trainees of the Odisha Administrative Service. As part of the program, the trainees had the rare privilege of calling on and interacting with the Hon'ble President of India, Srimati Draupadi Murmuji. Coordinated by Dr. Surbhi Pandey, the training aimed to broaden participants' national perspective on governance and strengthen their sense of belongingness to institution of public service. The session covered a wide range of themes including public policy and administrative ethics, development dynamics, accountability in administration, organizational structures, the role of state government, and design thinking in public administration. An evaluation of the impact of Mission Shakti in women empowerment in KBK districts in Odisha was carried out by IIPA. The study, commissioned by the National Commission for Women and conducted by IIPA faculty Dr. Gadadhar Mohapatra, evaluates the impact of Mission Shakti, Odisha's flagship women empowerment program, across 4 KBK districts: Kalahandi, Koraput, Balangir, Subarnapur. Since its launch in 2001, Mission Shakti has expanded to over 6 lakh self-help groups, reaching nearly 70 lakh women. Findings show that self-help groups' participation has significantly improved women's income, savings, financial inclusion, and social status, while reducing dependence on money lenders. Women have become more active in local governance and community decision-making. However, challenges remain in ensuring sustainability of self-help groups, market linkages, and upgrading from microcredit to micro-entrepreneurship. Policy suggestions mentioned in the report include strengthening traditional skills, adopting one block, one commodity models, better training in bookkeeping and entrepreneurship, and improving digital and market access. Overall, Mission Shakti has transformed women's life in Odisha by enhancing their social, economic, political, and psychological empowerment, and its model offers valuable lessons for replication nationwide. Today, we are taking a closer look on an interesting article by Dr. Nitin Agarwal on strategies to increase the contribution of women in nation building, which, as a study, explores strategies to enhance women's contribution to nation building by tracing equality practices from the Vedic era to current policies. It identifies key gaps in literacy, access to education, mobility, and social discrimination that limits women's participation. To bridge this gap, the paper proposes innovative digital grids covering health, education, skills, employment, and contribution, integrated into a national data grid for real-time monitoring, policy formulation, and proactive action. Recommendations span health and education security, skill-based training, income and job protection, flexible employment modes, and gender balance, without reservation but through inclusive framework. For a comprehensive analysis of gaps, frameworks, and actionable reforms, we recommend you reading the article published in the book Revisiting Sustainable Development Goals for Nation Building, Repositioning India as a Vishwamitra with a Vishwa Mantra by Professor Neetu Jain. As a part of Civil Services Day celebration, the Government of India presents a Prime Minister's Award for Excellence in Public Administration. These awards were instituted to recognize, reward, and motivate districts and civil servants for outstanding work in public administration. The awards highlight initiatives that have brought measurable improvements in the delivery of public services, innovative practices, and citizen-centric governance. Over the years, the scope has been expanded, now including district, state organization, and central ministries for exemplary implementation of flagship schemes, innovations, and effective governance models. Winner receives a trophy, citation, and a cash award, which serves not just as a recognition but also as an encouragement for others to replicate successful practices. At present, the awards are divided into a few categories, including holistic development of districts, aspirational block program, and innovation in public administration. And further, under innovation category, there are 2 awards for state-level initiatives. This award seeks to recognize innovation at state level from state government organizations for various innovation in any field of administration. This year, on the occasion of 17th Civil Service Day, Dr. Om Prakash, Mission Director, Samagra Shiksha, Government of Assam, received an award from the Prime Minister. Shiksha Setu, Axom, is an AI-driven initiative by Samagra Shiksha Assam that uses advanced facial recognition to ensure accurate geotag attendance of students and teachers, eliminating proxy attendance and ghost entries. Beyond attendance, it streamlines education governance with digital teacher leave management, transfer of students without certificates, and predictive analytics to prevent dropouts and aid resource planning. Built to work in a low connectivity or disaster hit areas as well with cloud and offline sync, the initiative has trained over 2 lakh teachers and officials, distributed 51,000 plus tablets, and engaged schools, committees, and parents for smooth adoption. Let's look at the impact of the initiative. Benefited 48 lakh students and 2 lakh teachers across 44,000 schools in Assam. Removal of 4 lakh ghost students saved the government 100 crores annually. 67% head teachers report improved teacher attendance, according to a UNICEF study. Strengthened trust and grievance redressal among teachers and school management. Won the National E-Governance Award 2024. Shiksha, Setu, Axom has revolutionized school education governance in Assam by combining AI-driven transparency with inclusive service delivery. With national recognition and large-scale impact, it stands as a model for future-ready, technology-enabled education reforms in India. That's all for this edition. We hope you found it informative and engaging. We'll be back soon. Thank you for watching. Until next time, stay informed, stay empowered. This is Governance at Work, powered by Indian Institute of Public Administration.